Hello, everyone, and welcome to today's conversation. Today, you'll be listening to a panel of experts talking about children's mental health. This spotlight series is being produced by Kennedy Forum, Illinois. And it is my pleasure to be welcoming all of you. I am Dr. Teresa Garate. I'm a founding board member of Kennedy Forum, Illinois, and I've been working with the panelists that you'll hear from today for many years. Today's topic has always been important, but today it's especially important. Over the last few months, we have seen traumatic images of violence that have affected adults and children, both at Uvalde, Texas, and Highland Park, Illinois. Very close to my home, by the way. Whether you are near or far, these images haunt us as adults and especially our children. Today's conversation is really about taking care of the youngest members of our society, our children. So you will hear from four panelists, actually three panelists and a moderator, all experts and people who have dedicated their life to children's mental health. Our moderator today is Dr. Orson Morrison, a clinical psychologist and professor at DePaul University, who has years of experience working with children and families. Amy Kennedy, who together with her husband, Congressman Patrick Kennedy, launched National Kennedy Forum and have supported Kennedy Forum Illinois for the last several years. She is also an educator and an expert in children's mental health. We are also going to be joined by my friend and colleague, Illinois Supreme Court Chief Justice Ann Burke, who has dedicated her life to advocating for children and youth. And last but not least, Dr. Colleen Cicchetti, the Executive Director of the Center for Childhood Resilience and a subject matter expert on children's mental health. These experts and our moderator will be engaging in an hour-long conversation and sharing some information and insights that we hope you will find valuable and a way to empower ourselves to support our youth during these times of trauma and overall uncertainty and sometimes depression and anxiety. With that, I'd like to turn it over to Dr. Morrison. Orson?
Thank you so much, Dr. Garate. It's my pleasure to be with you today with such a talented and accomplished group of leaders in your respective fields to really have this conversation on children's mental health. As a clinical psychologist myself and the parent of two teenagers, these issues of children's emotional well-being hit close to home. And I've seen over the last couple years in particular, many children and families really struggling with the heaviness of living through a global pandemic, dealing with issues such as our country's reckoning with systemic racism, the ongoing incidents of community violence, gun violence that's really shaking our communities, as well as other issues like climate change. And so I really want to start by having us each reflect perhaps on this moment in history and what we've learned perhaps over the last couple years about children's mental health. How are our children doing? What have we learned about what they need, perhaps? And perhaps I could start with Dr. Cicchetti, if you wouldn't mind kicking us off with your reflections um, on where we've been.
Well, thank you. It's really nice to see all of you and to think about this topic. It's a topic that's been my passion for the last 30 plus years. And I agree. It's a really interesting time to be thinking about children's mental health. I feel like we're in a moment in time where the awareness of children's mental health needs and the importance of taking a public health approach is the highest that I've ever seen in my professional career. And part of why we're at that moment is because so many kids are hurting. I think, as we all know on this panel this morning, that children's mental health and the system that provides the mental health coverage and care for our children has been sorely broken for a long time. It has not been adequate. We believe that the estimates range from 25 to 50% of kids who ever need mental health services ever actually see a mental health professional. Of those that do, 60 to 70% in most estimates, the only mental health professional they'll ever see are those that work in schools. And so having a system that's devised and developed to be delivered through healthcare and hospitals is just not working. we really need to be thinking differently about what does it mean to promote health and wellness where kids live, learn, and play. And that's really the work that I've been doing, and so many of us together at the Kennedy Forum have been doing. So from my perspective, what I would say is that children, all of us, have lost many of the things that during the pandemic, we lost a lot of the things that really are protective factors for health and wellness: connection, structure, routine, community engagement, all of the things that we do and know need to happen to live our full engaged lives. And so what we've seen is that we've lost that. It's been a stressor, it's been a disruptor for everyone. And so we're all under pressure and we're all struggling. However, I'm very clear that it's not the same for everyone. And so some people want to say this is trauma. I would say most of us have had chronic stress. Others have had what we would really consider toxic levels of stress, where there's been insecurity with housing and food and domestic violence and stress beyond what they've experienced in the past. And then there are others who really have had true trauma, where they've lost loved ones, where they've been exposed to this chronic violence. And so what we really need to be doing is not a one size fits all, but really thinking about how to develop a system, use the strategies many of us have been working on to get all kids some strategies for coping, because most kids are going to be okay. Kids are resilient. They're looking at adults. They want to be back and healthy and living their lives. Most kids are going to be fine, but we need to know how to identify who those kids are who need more and get those kids services as soon as possible, not waiting until there's an emergency or a crisis to get them help.
Thank you so much, Dr. Cicchetti, really speaking to all the very important things that our children need to thrive, right? That connection, that system around them that really responds to their individual needs. Thank you so much. How about Chief Justice, if you could share some of your thoughts about what you've learned over the last couple of years about children's mental health. Where are we right now?
Well, personally, I've kind of lived the experience since I was a young mother, even to this day as a grandmother, of having to live with people who might have some issues. And so when you mention systems, and Dr. Cicchetti mentioned systems too, that's as a former basketball coach and team coach, I look at systems all the time and what skills is needed to play a basketball game. I could do the layup, but somebody else has to do the free throw. But I have found that the pandemic challenge, maybe it's not the challenge we wanted, but has given the opportunity to the justice system, but I think to all of us, to change what hasn't been working since one of my children in 1970 presented with some mental health issues. There was almost nothing, and if we hadn't been who we were as educated families, we wouldn't have sought out necessarily some help in the 70s. And now having a grandchild in the situation in high school who's presented with issues during the pandemic, the services, the systems haven't changed that much. And I'm finding that after hospitalization, there's no step down in Chicago except one for millions of people. And so where have we been in the last years since the 70s? So people do present to us in the courts often, and isn't that a little late by that time? So children's health has to be our utmost concern going forward, starting with teachers. There was a program years ago when my youngest child was in a daycare. The State Board of Education had a program to screen daycare, but only if the daycares agreed. And he presented with issues, but we already knew he was a fetal alcohol cocaine baby and had learning disabilities. But the Board of Ed presented opportunity for him to have a teacher teach the teacher in daycare how to work with him and get an IEP at age 3 and then go through the systems. Now, if that hadn't occurred early on, he wouldn't have had all those services. But why isn't every daycare getting those services for every child? I mean, those are the things that I'm really concerned with. So I don't have to see people in the mental health court or the drug courts because they present by the time they're even juveniles. So I think that the remote room that we're in today has been significant because telehealth can provide those who can't make it to a doctor's office, those who need to be visiting with their children, and for the person, even children, to be happy to go on a cell phone and talk to their doctor. I mean, those are the kinds of things we have to teach the general public about. As experts, yes, we can talk this language among ourselves, but how do we get it to the general public? Through the schools. And another person in a child's life is either a parent or a grandparent to work with. So we need to think about how do we reach out what we know to others so our children can have a safe haven. So I really kind of was all over the place there, but I just had a lot on my mind to tell you that being someone, not as an expert, but someone who's lived the experiences and sees it in the judicial branch.
Thank you so much, Chief Justice. So many really important points, and perhaps throughout the conversation, we'll maybe dive a little deeper into some of those. But you're right. I mean, as a clinical psychologist myself for over 2 decades, these are issues we've been talking about, right, for so long, and there haven't been many changes. But, as Dr. Cicchetti was saying, some of us are really experiencing this chronic level of stress, and some of us at this really toxic level. And I think that's sort of what has come out over the last couple years, right? It sort of really brought all of these issues, I think, to a head. And it's now time to sort of make some changes to the system to really prevent these sorts of ongoing stressors for our children and families. Amy, how about you? What are your thoughts on the children's mental health system, or what you've learned over the last couple of years in relation to where we are historically now in this moment?
I think it's so important that we've established that this really is not all pandemic related, that this is an existing challenge that so many people have faced. So while we celebrate the funding that's come along with the pandemic to be able to help start to address mental health needs, we know that this is something that's going to continue long after the pandemic. And so we're thinking a lot about that and about how we can start to address the gaps in the system that we've identified. I think it's also brought to light just what an important role school plays in helping to identify students that are in need, young people at the very earliest stages when they're struggling, when they lost that connection. It takes much longer for them to receive services. And so being able to have those early interventions will be key to helping to address all of our students' needs with a shortage in the workforce that we're seeing. If we can address it earlier, it means that they'll need less intensive supports. And so I've been able to watch my own 5 kids through the pandemic as they've had ups and downs, and how getting back a sense of connection with their peers has been really helpful and has helped them to kind of move through some of the challenges that they were experiencing. But knowing that, the moment they got back into the classroom, it wasn't over, and that we'll continue to see these struggles, and we need to be very aware of how we're advocating to make sure that there's sustainable funding to address the future for these young people.
Thank you so much, Amy. All of you spoke about the system and access to quality care, particularly as it relates to school-based mental health. And I'm wondering if if any of you would like to speak more about that particular priority or any other priorities that you feel are particularly important in relation to children's mental health. And perhaps I'll start this time with Chief Justice. If you could share, what are your top priorities related to this topic?
Well, I think one of the top priorities is to make sure there's services. I mean, if a child presents either at school or in the court system or at home, there are no services available. I know in juvenile court, they want, a child presents themselves with with problems, but they have no place to send them. And the services in the state of Illinois, there's 102 counties. Well, there's at least 20 counties that have no services at all for people who present with any kind of behavioral issues. So it's building up that system. And as an alternative, there has to be money for a telehealth system. I mean, the ability to access telehealth. Now, we have a behavioral director we hired this past year, and we're setting up a new pretrial program. And each pretrial officer will have a cell phone and access to telehealth services if somebody presents at the first court call. We can set them up through telehealth to get started, and that's will be a condition of release. And for children as well, I think that it should be something that they can do and be familiar with. One of the good things is my high school grandson who presented this year, is that he didn't feel a stigma like my son did, in the 70s. He had friends, 7 or 8 of them, who presented with behavioral health as a junior in high school in Chicago. So he was familiar with being able to talk about it so he could tell his parents and then get something done. So that dynamic of conversation, we have to present more it's not one or the other. It's so many different ways. We have to talk about it at school. There has to be sessions at school. There has to be role playing. There has to be ability of all kinds of things for little ones to know if they don't feel well. And the teacher is aware that something's different today than it was for the last week with this child, and talk to the parent. So there has to be education of parents involved. The court system provides the opportunity for biological parents to see their child who's not with them anymore on it could be a weekly basis on telephone in video conferencing. We should be using the electronics that we have with what we have now and just make it larger services available as ordinary opportunities for kids.
Right.
Like they're going to go to play a game or they're going to talk to their friends. They should be able to reach somebody who has a smile. Yeah. Like you do, doctor. Clearly. And just say, hey, listen, today's been a bad day. Can I talk to you tomorrow? Whatever. I just think that the commonality of talking about behavioral health will make a big difference.
Absolutely. You raise an interesting point. Certainly over the course of my career, I've definitely seen this improvement in reducing stigma. People are more open. Kids are more open to talking about mental health. But the access issues are still so prevalent, right? And you speak to this priority of really expanding telehealth, telemedicine as one option. I'm wondering if Dr. Cicchetti, perhaps, if you have any thoughts about other priorities related to our children's mental health system.
Absolutely. I think you're right, Justice Burke, in relation to telehealth. I think we need to make sure that the laws that were changed during the pandemic to make access to telehealth stay. There's some states and some insurance companies pushing back on that. So we definitely have advocacy efforts that all of us can get involved in to make sure that that's available. I also think it's important to remember that it's an incredibly helpful tool for so many, but we have to do some studying. So people like Dr. Morrison and myself, for whom is it the right service? so that we can start to match the right kid to the right service at the right time, because it's not perfect for everything, but it's really fantastic for certain things, especially for our younger children. When we're talking about, you mentioned early childhood, we are doing a project with Head Start right now. We're very excited about a National Head Start Center for Safety, Behavioral Health, and Health that we're working with. And we've created a tool to teach teachers called Ready to Learn Through Relationships. And that tool was developed in Chicago Public Schools with the Chicago public school teachers, saying we need more than a one-time training on how to manage this. We need tools that we can plug and play, so that if a child's presenting with one problem this week and a different problem next week, we as teachers can go to this resource and know what to do. So we've got that project. We've been piloting it here in Chicago, and we've brought it nationally, and we're going to be testing that out and tweaking it and building it out for our youngest. Right now it's for 3 to 5-year-old classrooms, but we're hoping to go 0 to 5. We're also adding a parent component, hopefully with technology, because parents all have their phones. So if we can be texting them and reminding them and giving them help and support, we know that's going to go a long way. So Head Start and early childhood is absolutely critical. I think the other opportunity, like you said, Dr. Morrison, is the idea of the stigma in schools that has changed so much. I think really Illinois was one of the first states in 2003 through the Children's Mental Health Act to create social emotional learning standards. We know that we have language. We've got standards, just like reading and writing and math, from 0 all the way to 18 of what skills kids know. The problem is that it was a kind of a common thing that happens in our state, which is an unfunded, unmonitored mandate. And so it's out there. Every school has this, but most schools, if you walk in and ask them, do you have this? They can't tell you what it is. Or I get calls from people saying we need bully prevention. And I say, well, let's start with your social emotional learning standards. What are your programs doing? What are your teachers doing? How do we help? I think during the pandemic, one thing that we've seen is educators have said loud and clear, we need help. In the past, they've often said, we don't want to be social workers. We can't do this. During the pandemic, they said, please help us. The kids that we're zooming in and what we're seeing in their homes really is difficult. We don't have the skills. So in Illinois, we created, at the request of ISB, a website that just put up some information to help educators with all of these issues. And within 2 weeks, we had almost 2,000 people on it. We now have over 6,000. We've created something called the Resilience Education to Advance Community Healing Project, which is REACH. And what we're doing is we're creating an opportunity, a web across the state with the federal emergency dollars that came in, so that each region has resources to help teachers do a needs assessment in their school. It's a school community process where you look at what are we doing for overall school safety for our staff, for our families, how are we engaging families, how are we screening kids and identifying what kids need what, and then delivering those services through collaboration. So that's something that Dr. Morrison and I have worked on for a long time. Schools are not staffed to provide the mental health needs for everyone beyond the special education kids. So we need to have these school community partnerships like the ones that Dr. Garate and I started years ago with Chicago Public Schools to support students. And we're seeing that now developing across the entire state. But as you mentioned, there's not providers in parts of our state. So we have, I think 80% of communities in our state don't have child psychiatrists. And what we know is the only way they're going to get them is if we build a workforce. So another thing that we've done with some federal dollars recently in our building in our state is a behavioral health workforce center to really think about who needs to be trained. How do we recruit those same young people who are in schools wanting to have these conversations? How do we get them into the field? We bring them to the hospital. We have Discovering Health Careers. They all want to be surgeons or sports medicine docs. But after they get to know about mental health and social determinants of health, they get very interested. We can get them out being peer promoters and mental health promotores and going out and talking to people. And they love it. And those are the kids who will be our future providers, because kids will say, I want to talk to someone who looks like me, who lives in my neighborhood. So we have to change the whole workforce. And I think that that's happening in our state, but it's happening slowly. And we're going to need to move a lot faster to meet the needs. But I think the good news is we've seen these innovative programs, and no one is anywhere in the state anymore is saying, not in my backyard. They're saying, I need this help now. And it started with the opioids, and it's continued with the pandemic. So this is the moment where we can build these systems, but we're going to have to figure out things. And so it's all part of the process. Over the years, it's been philanthropy that's paid for it. That can't happen anymore. We can't use our education dollars to pay for children's mental health. Parity is something that I know your husband worked on, and we have it on the books, but it's not real. Anyone who has a kid with mental health issues knows that there's no such thing as mental health parity for children's mental health. So we've got to really elevate that message, get that out there, and be innovative, build those pipelines, get people talking earlier. I always say we're not going to mental health our way out of this. We've got to train the Girl Scout leaders and the soccer coaches and the faith leaders to have these conversations with kids. And those are the trusting adults that kids will go to when they don't feel like they can talk to their parents. We know there's a huge delay between getting symptoms and getting treatment. We've got to cut that down. We've got to get kids being honest about the fact that they're hurting and connect them to whoever, teachers, parents, adults, grandparents, peers, who can say, that's not okay. Let's get you some help. And that's what we need to be investing in.
Thank you so much, Dr. Cicchetti. What I've been hearing from all of you is really this importance of prevention, like early intervention as a really, really important aspect, a needed aspect in our system. Before kids end up in juvenile the justice system, before kids end up in higher level of treatment care, we need to do a better job of prevention. So I'd like to kind of just spend a moment to reflect upon prevention, and perhaps I could turn that over to Amy. Any thoughts about the importance of prevention when we talk about moving the needle on children's mental health, and what from your perspective related to prevention can we do more of?
Well, I think it starts early. It really is about thinking the whole family and how we get everyone involved. And we know that young people are more able to talk about how they're feeling, but that has to translate through the whole family so that when they first start to show those signs or talk about the challenges that they're experiencing, that their caregivers are open to that and are helping them seek out interventions right away. We also know that, the screenings that we're thinking about could be implemented in schools, in the primary care office, and that those screenings can be done during points of transition. So, as you're entering school, when you're transitioning to middle school and high school, those are really important times to do screenings. The U.S. Prevention Task Force has recommended that those screenings be covered by insurance. So thank you for that shout out about parity, because it is so key to this, and making sure that all of these treatments and interventions are covered, just like you would any other physical service that is needed for your health. And so, as we look at what schools could be doing, we're thinking about multi tiered systems of support and knowing that kids should receive care appropriate with the symptoms that they're experiencing. And so, if we are able to implement multi tiered systems of support, we'll have that very universal screening and social emotional learning or life skills that we can bring to all students. But then, if there are students that are showing challenges, we can do small group and we can do even more targeted interventions in a tier 3 level. But having all of those levels and also the community partners that we're talking about would be really part of that system and be able to plug them in to assist where needed, because we know not all students will be okay with just the general, prevention piece. There's still going to be kids that struggle, and we're going to need to have all the levels of support in place to address those needs as they come up. The funding for that will mean that it's not just going to be those education dollars. We have to look at how we're writing 504 plans and what we look at for IEPs, and how we also have funding in place for the trainings, as you heard, for educators, for all support staff in the school, so that they can be a part of the solution and help build out that workforce. I believe that students are already starting to talk about this online and how they can support one another and what self-care looks like. And we're seeing some ways that social media can help young people as much as it also can be a detraction, and really looking at what connection means when it comes to prevention. So is connection online what we really mean when we're talking about connectedness and how we are maintaining good mental health? So redefining what that looks like in a time of technology and social media will be an important step forward.
Thank you so much, Amy. Really, really pleased to hear that you mentioned universal screening and systems like multi-tiered systems of support. Really, a very individualized approach to children's mental health. Right, a lot of emphasis on prevention, on training, making sure that folks around children understand and can recognize the signs and symptoms of children's mental health issues, and then a menu of supports to really be able to offer kids what they need. How about you, Chief Justice? Any thoughts about the role of prevention in
Well,
regards to children's mental health?
yes, and I affirm everybody who's spoken already. And I would just wish I could articulate what I'm thinking. I really am a lover of stories. I feel that if there's some way we could, and Kennedy Forum could do this nationally, Amy, and locally, is have an app. Let me talk about me, some sort of a something like that, that kids could have same pure age about talking about how I feel, how I've gotten help, and who's helped me, and that suggestion. So if there's some sort of an app where there's different people talking about kids talking about their stories, even little ones, if permitted, through proper screening and everything. I just think it's important for some children to listen to somebody else and not have it shoved into with the doctor and everything like that, except present company excluded doctor. But I'm just saying that it's important for stories, and if there could be almost like a cartoon type of an app, let me talk about me, and then you could scroll down, and kids know how to use that little iPad very well from very young, and it's just talking about this is how I feel today, and what do I do about it, and who do I go to get help from. Just those simple things is a prevention from early on. And I just remembered the program that the state had before was called Child Find, and that was dedicated to daycare. I don't know if they still have it, but it was very helpful. And then that child had, if needed services, got services from the time of age 3, all through the public school system. But that's the kind of prevention I'm thinking about,
Absolutely, yeah.
is to listen to each other. And I know that the kids that I know, that they talk to each other anyway. They're going to, but if they had an app that was didn't say behavioral health or things like that, it just let me talk about me. You can talk about you too, or something like that. Something that's kind of catchy.
Absolutely. I think you're raising the point of how do we use technology in a way that helps to promote connectedness, helps to promote our children's social and emotional well-being. We hear a lot about the impact, the negative impact of technology on children's mental health. And, it is an opportunity, I think, for us to innovate and think differently about how to use technology in other ways. Dr. Cicchetti, you have something you'd like to say?
Yeah, I just wanted to add that you're absolutely right. The power of storytelling is so critical. And what we've seen is actually one of the best places that we've been able to push in and really promote this mental health engagement with other adults is in the arts programming. So arts theater, arts drama, writing. We had a project in Chicago called the Time Capsule, and we asked kids to put in a time capsule what they wanted kids 20 years from now to know about their experience of the pandemic. And they had thousands of entries, and we're creating a book about that with a group here in Chicago to really say, share your story. What do you think kids are going to want to know about how tough and resilient you were, right? And so that kind of project is out there. I think there's projects that are both technology and hands-on. We pushed it out to libraries and the Girl Scouts and every summer camp in Chicago schools to get people to tell their stories. And I think you're absolutely right. And what we know is the art of storytelling is critical also for the young person, because when we can say, this is my story, this is who I am. Some of these things that happen to me are bad things or scary times, but it's not my whole story. I own who I am and what I want to bring to the world. And that is actually what most trauma treatment is all about. It's
Yes.
really being able to integrate what's happened to you into what you want to do when you go forward. It's not about letting that horrible event control everything that happens afterwards. And kids need help to do that.
Yeah.
Thanks, Dr. Cicchetti. Go ahead, Chief Justice.
To add to that, in the juvenile justice system, there is a program of theater called Story Catchers, and all those individuals who are juveniles tell their stories, but they put it to music and theater. They don't tell their own story. They tell their own story, but then the theater script is you play somebody else. So it isn't really you, but it's a wonderful application. But why can't we do that more and have a presentation or a spot on, a video or a curriculum item for the schools? Making history with your story, and every school has to submit, and then there's big stories all over and make it a big thing and celebrate it. It's a celebration because
Absolutely.
Kids are talking and kids are being able to act out and in a healthy way and get help that way.
The healing power of youth voice and youth stories. Absolutely. I want to, Amy.
I was just going to say, I think when we talk about prevention, one thing that we didn't mention is social determinants of mental health. If we don't really address that, I think we're missing a big piece of what we all understand through ACEs, through so much of what we're learning about healthcare more broadly, impacts our overall well-being. So, of course, poverty and race and all of these equity issues that we're talking about when it comes to care need to be a focus for mental health for our youth as well. There is no prevention unless we're looking at that whole picture of what it means to have a healthy life and all the pieces that are required, because no matter what we try to do on the treatment end, unless we're setting kids and families up for success in the beginning, we're going to always be a little bit behind and trying to remedy instead of just building for that well-being. And so Mental Health America has a great saying, before stage 4. And that means, like any other disease, we know the earlier you can intervene, the better or more successful the outcomes will be. And so
Absolutely. That's actually a perfect segue. I did want us to spend a little time to reflect upon sort of the differential impact or the disparities that we see across the world of children's mental health related to issues such as race and ethnicity and socioeconomic status, and how some of our groups of youth are really struggling to a much higher level. Kids that are identified as LGBT, for instance. Any thoughts about what our system needs to do to meet the needs of specific populations? And perhaps, Amy, you could start.
It really feels like we're failing our youth that need care the most. We can get closer to identifying struggling kids, including those that are most risk for untreated conditions, rural youth, LGBTQ plus. Providing support and delivering treatment that allows our kids to thrive will be so important. The Center for Law and Social Policy recently conducted an analysis of 37 state plans for reopening to better understand how schools were prioritizing culturally responsive, trauma-informed, and healing-centered care, and highlight a number of recommendations for this kind of work. Schools need assistance in training for culturally responsive care and in creating environments that affirm racial and cultural identities. New York's adopted this type of framework. And we're thinking about how that can be reinforced through our curriculum as well. We're seeing so many states that are also pushing back against this at the same time. So, how do we look at the way we're framing this type of policy and making sure that it still feels like it includes caregivers and that they're part of the planning for this, and it can be adopted more widely because students are going to need that kind of care. The expansion of Medicaid state plan amendments, 17 states have already done this, but that will be key for making sure that there is funding for the treatment that is needed at schools. And for those states that haven't done it, you can take a look at the scorecard on Inseparable's website. The Hopeful Futures campaign broke down where each state falls in kind of their adoption of some of these practices. But really, I think that's, again, another place where telemental health has helped make culturally responsive care a little bit more accessible in making sure that, there's somebody that a youth could talk to that looks or identifies as they do.
Thank you so much, Amy. Such a great list of both policy and intervention practices that should be considered. I'd like to talk a moment about a more difficult topic, the topic of suicide, youth suicide. We've seen the rates of child and teen suicide increase over the last decade or so. And just sort of wanted to see what your thoughts are on what's happening in our larger system that is perhaps creating these issues, and what can we do as a mental health system to address the need. One of the things I thought about when you said universal screening, Amy, that is such a powerful tool, I think, in this particular topic of suicide. So any thoughts? Who would like to kind of kick us off with this particular question?
Well, I'll take a stab at it, but it's all the things we've been talking about so far. Is, a young person becomes so depressed and so into themselves with no hope for anything, and causes that issue to present itself. Fortunately, there's the new number, the 988 number, but that's at the last ditch hope. So it's like just mental health, behavioral health itself. There's a whole generation of people who didn't want to ever talk about it, including myself early in the 70s. I mean, I didn't know anything about it when we had a child that has some issues. And things have changed. And it's, again, talking about it to the general public, with the general public and other collaborators. There's no question about a child who might be having some issues acts out. So police might be involved. We have to have the police work with us, reach out right away to have some behavioral health issues looked at. All kinds of stakeholders in the community, the church, whatever community level it is. But I still go back to the schools. The teacher knows the child even more than some parents know their own child. And just a red flag to a parent, or if that doesn't work, that intervention doesn't work, then to a health professional in the school just a conversation might help with that child. So it's the discussions, and it's not one thing or another, it's everything at once. We have generations of people who don't even want to talk about it, and we have generations of people who don't know enough about it and are afraid of it, and then those who are just not paying attention, or the child doesn't have anybody close to them that they feel comfortable with. So I think this kind of a webinar with all these issues brought out, but we need an action plan, and many of them for us to take. And not everybody can do it all at once, but we need to reach out to those who can be part of the team and do this. And someone else should do that. But I do think schools and daycare. Yes. So.
Thank you so much, Chief Justice. Dr. Shiketti.
Yeah, I'd love to just jump in because I think what you just called out, which was we need an action plan. The good news is in Illinois, we have several action plans that have just been presented in the last couple of months. So the Children's Mental Health Partnership created the original action plan in 2003, and we've since been able to, just this past year, revamp that. So first of all, we've added social determinants of health in addition to the other three aspects of mental health. In the plan, we are asking for specific actions to happen to address all four tiers, from social determinants of health to prevention to early identification and services to the highest end. We also currently have something called the Whole Child Task Force that was created by the Black Caucus and led through ISB. And through that process, we've created a whole set of data points and recommendations for our state to follow. It includes adopting common definitions of what it means to be a trauma-informed or trauma-responsive school or community, and then it builds out what do we need to do for pre-service training in all of the child-serving professions? What do we need to do to change professional regulations and add some of this awareness to things like mandated reporter training? So we have a whole set of recommendations. We also have currently a great colleague of ours named Dr. Dana Weiner, who was asked by the governor to create a whole children's behavioral health transformation plan in December. So what we need to be prepared for, and the listeners to this webinar need to be able to do, is to say, let's look at those proposals and say, what is it that Kennedy Forum can get behind? What is it that my local PTA can get behind? What is it that the teachers unions can get behind? Because we have plans. And so this is the moment where we've got plans, we've modified them, we've added them to the 20th century, and now we have to put the dollars in place to make these things happen. And I think what I would say around suicide is, again, kids are much more likely to tell their peers than anyone else. So we have to get away from the stigma. We have to talk to kids about feeling words and vocabulary starting in preschool. So when a kid says, I'm not happy, they know that they can go to somebody and they're going to connect them to an adult to help them. I talk to kids, my own kids, about the difference between tattling and asking for help. If a kid is coming to you asking for help and the problem's too big and you can't solve it, go to an adult. If a kid is just doing something that you want to get them in trouble for, don't do it. But the fact of the matter is, we know that kids, and especially young kids, can have these conversations. There's a great new movie that just came out from the Ken Burns group called Hiding in Plain Sight. I know Patrick was part of it, as were some of our colleagues. And it's looking at 20 different young people all saying the same thing. We were hurting. We didn't know where to go. Some of their parents tried really hard to get support and weren't able to navigate the systems we've been talking about. But I think that the suicide pandemic is real. I think that the social isolation that we've seen, and also, once again, access to videos and people online who can tell you how to go through with your wishes, those are all things that we've got to consider. And so young people will say it's not all social media. I actually find the people I can connect with. Back to your question about intersectionality, I find people like me elsewhere, and that can be a great resource, but it can also be a source for really horrible behaviors. And so we really need to, I say all the time as a mom, we need to be on these mediums with our children. We can't turn this over and just say, that's not our generation. I don't know what's happening on those websites. You need to be watching, you need to be looking. And we've got opportunities with the Attorney General's office around creating some contracts about what kids can and can't do online. We need to be not saying that this is not our world. We need to jump in there and figure out how to help our young people, because they are begging for help. We've seen it, unfortunately, in suicides. We've also seen it in homicides. The two recent shootings that we've seen in both Texas and in Highland Park, those were students who shot those guns. Those were students who had graduated in the last 2 years from those high schools. So what are we doing that we're getting students out of high school with those kinds of mental health issues, and we're not addressing them? That's not to say that this is a mental health problem, but we know that there are kids who are hurting, and we're not connecting them to those adults. We're not getting them the support they need, and we're letting them find peer groups online that only exacerbate these really hateful, angry thoughts. And that has got to stop. And the gun access has got to stop. We don't need kids having guns that can kill that many people in 5 minutes. It's absolutely absurd that 18-year-olds can have access to those guns.
Thank you for those points. Amy?
That would be my, final point. It would be the same access. We saw in that film, Hiding in Plain Sight, Dr. Tom Insel alluded to the uh, path of just being able to intervene, even temporarily, postponing someone's thoughts 10 minutes. And it may have different results because it's usually something very impulsive. So if we can intervene and make sure that young people don't have access to either the weapon or the online platform that may be giving them the steps to go through with something like that, then we've just likely saved lives. So that's an important accountability piece that we need to be responsible for. I know social media platforms have to be held accountable. Gun manufacturers and states and their legislation needs to be held accountable for how accessible these things are, so that when we have a young person who's vulnerable, it's not so easy. And we just need to make sure that we've done the work to make that happen, and know that there is recovery for these young people if we can intervene in that moment of crisis through mental health first aid, through other ways that we can figure out that they're struggling. If we can get them into those channels, we'll save lives.
Thank you for that, Amy. We've covered a lot of ground during this conversation, and just in wrapping us up today, I want us each to reflect, or each of you to reflect on perhaps one bright spot, one thing that you would like to leave this conversation with and spotlight as something that you feel can really make a difference in children's mental health, whatever that may be. And perhaps I'll start with Chief Justice.
No,
Go ahead.
I think that the bright spot is technology right now, because it's easier. It doesn't really cost all that much, but there is a gap between a child who is alone, and once they graduate from grammar school or high school or even are in college, they don't have a space that they can go to. So that's why I feel that an app for stories for everybody is kind of like a home, it's like the dugout where you can go and just find someone like you that is happy, gives you hope, and probably even suggest, I went and got some help from so and so, services or whatever. But an app or something that young people, all ages, could go to, that it's a place that they can see somebody like them. And then that, with information of you have issues, you can call these places, kind of an informational bulletin board.
Thank you, Chief Justice. Dr. Cicchetti, how about you?
I would have to say that it's the young people who are giving me as much hope as possible. I think the more that we engage with young people and ask them how we can help them and follow their lead, the better it's going to be. I think the school-based services that we've worked on for years, making available in schools, is fantastic. But young people tell us every time we still don't know who to go to. So I know one of the schools in Chicago just created, based on what Judge Burke just said, a QR code that kids can take a picture of in the bathroom and say, I need to talk to someone, right? That came from a young person saying, I don't want to fill out a piece of paper and go hand it into the social worker's office, but I'll do a QR code app, right? So the young people have the solutions. They're the ones that are leading these conversations. I think that, those of us that are older and have old-fashioned views of what mental health is and isn't need to step aside and really encourage them to step up to the plate, because they've got so many great ideas and they want to help and they want to do it and they want to talk about it. And we see it in the youngest ages with peer-to-peer support. So I believe if we follow the lead of the young people, we're going to figure out a lot of solutions.
Wonderful point. Amy, how about you?
Yeah, I'm really hopeful based on some of the legislation I'm seeing proposed right now, I believe that we're starting to see a focus and a demand politically that this is what we want moving forward and what we know is going to work. And that's going to come from uh, outcome based measurements, it's going to come from precision medicine, from people knowing that there is hope and that recovery is possible and that they can access care. Because when the system seems so difficult to navigate, or like there isn't a way for us to overcome these challenges, it's it, it does feel hopeless and it feels overwhelming. But when we start to hear stories of success, stories of recovery, stories of young people who are now working to bring help to others, then we know it's possible. And that's where we get excited and we know that there's going to be a sea change in the way we experience the mental health system. So the integrations that are possible now, I think because of the pandemic, we're going to just open doors and see hopefully more funding continue down this path that will lead to earlier interventions and better outcomes. I'm really excited for those who are interested in learning more about it to take a look at that state report card that I mentioned and some of the work that Kennedy Forum's continuing to do in this area, and hopefully continue to apply pressure that there is real parity that will be achieved in making sure that those treatments are available.
Thank you so much, Amy. Yeah, just bringing us back to that first question, what you were just speaking to, Amy, is that, this moment is heavy, but it's a moment that we should leverage. We should leverage the momentum that's coming out of this time to really, really make changes to our system that will positively impact the lives of children and families. It has been my absolute pleasure to be speaking with all of you today. Our conversation has been really broad and expansive, and truly an honor to speak about this very, very important topic. Wishing all of you safety, happiness for the rest of the summer, and just thanking all of you for all that you're doing related to children's mental health. I'm going to turn it over to Dr. Garate.
Thank you, Dr. Morrison. Thank you to our panelists. We hope that all of you found that conversation engaging and educational. For me, it definitely was. As much as I am an advocate and an educator, every time I listen to our experts, I think once again how important this is and that we must pay attention to the youngest members of our society. As we part today, and as I say farewell for today, I want to hopefully remind all of you that there is something you can do. By participating in this panel, you already have done something. You've decided that this is an important topic and that you wanted to learn. But really, this is a call to action. We must do something. We must not forget that our children are a precious future and that we must focus on prevention and on them. When I was a teacher, I used to always be mindful of what I said because I knew that my students were listening. Even when I thought they weren't listening, they heard everything I said. When I teach at the university, I tell future teachers, be careful what you say. You are powerful. Children are always listening to you. And we must also listen to them. Don't take anything for granted. If they say something that is concerning, please do something. And what can you do now? We can continue to provide these spotlight series and these educational opportunities through your support. So one way to get involved is to visit our website, Kennedy Forum, Illinois, or National Kennedy Forum. There's lots of resources there that you can use to continue to be advocates for mental health parity and to end stigma, but also to focus on supporting our youth. With that, I want to thank everybody for participating, and we'll see you soon at our next Spotlight series.